Welcome to the Purdue Global Academic Success Center's presentation on respiratory acidosis. Acidosis occurs when acid builds up or when bicarbonate, a base, is lost. Acidosis is classified as either respiratory or metabolic acidosis. Respiratory acidosis develops when there is too much carbon dioxide in the body. Respiratory acidosis is a state in which decreased ventilation, hypoventilation, increases the concentration of carbon dioxide in the blood and decreases the blood's pH, a condition generally called acidosis. Respiratory acidosis is a condition that occurs when the lungs cannot remove all of the carbon dioxide the body produces. This causes bodily fluids, especially the blood, to become too acidic. Carbon dioxide is produced continuously as the body's cells respire, and this CO2 will accumulate rapidly if the lungs do not adequately expel it through alveolar ventilation. Alveolar hypoventilation thus leads to an increased PaCO2, a condition called hypercapnia. The increase in PaCO2, in turn, decreases the HCO2 minus PaCO2 ratio and decreases pH. The primary disturbance of elevated arterial PCO2 is the decreased ratio of arterial bicarbonate to arterial PCO2, which leads to a lowering of the pH. In the presence of alveolar hypoventilation, two features commonly seen are respiratory acidosis and hypercapnia. To compensate for the disturbance in the balance between carbon dioxide and bicarbonate, HCO2-, the kidneys begin to excrete more acid in the forms of hydrogen and ammonium and reabsorb more base in the form of bicarbonate. This compensation helps to normalize the pH. The frequency of respiratory acidosis in the United States and worldwide varies based on the etiology. End-stage COPD patients are more prone to develop this acid-base disorder. It's also been noted that surgical patients are at a greater risk of developing respiratory acidosis. Metabolism rapidly generates a large quantity of volatile acid, H2CO3, and non-volatile acid. The metabolism of fats and carbohydrates leads to the formation of a large amount of CO2. The CO2 combines with H2O to form carbonic acid, H2CO3. The lungs normally excrete the volatile fraction through ventilation, and acid accumulation does not occur. A significant alteration in ventilation that affects elimination of CO2 can cause a respiratory acid-base disorder. The PaCO2 is maintained within a range of 35 to 45 mmHg in normal states. Alveolar ventilation is under the control of the respiratory center, which is located in the pons and in the medulla. Ventilation is influenced and regulated by chemoreceptors for PaCO2, PaO2, and pH located in the brainstem and in the aortic and carotid bodies, as well as by neural impulses from lung stretch receptors and impulses from the cerebral cortex. Failure of ventilation quickly increases the PaCO2. In acute respiratory acidosis, compensation occurs in two steps. 1. The initial response is cellular buffering, plasma protein buffers that occurs over several minutes to hours. Cellular buffering elevates plasma bicarbonate, HCO3, only slightly, approximately 1 MEq per liter for each 10 mmHg increase in PaCO2. 2. The second step is renal compensation that occurs over 3 to 5 days. With renal compensation, renal excretion of carbonic acid is increased and bicarbonate reabsorption is increased. For instance, PepCK is unregulated in renal proximal tubule brush border cells in order to secrete more NH3 and thus to produce more HCO3-. Respiratory acidosis can be acute or chronic. Acute respiratory acidosis occurs after a sudden spike in CO2 levels once your body becomes less effective at getting rid of CO2. This type comes on quickly and qualifies as a medical emergency. Without treatment, symptoms will get progressively worse and they may become life-threatening. In acute respiratory acidosis, the PaCO2 is elevated above the upper limit of the reference range, over 6.3 kPa or 45 mmHg, with an accompanying acidemia, pH over 7.36. During chronic respiratory acidosis, certain chemoreceptors in your brain alert it to states of elevated CO2 and control your body's ventilation, or how it disposes of waste gases in your blood. When these receptors become less sensitive, they might not pick up on elevated levels, leading to chronic respiratory acidosis. This type develops over time and doesn't cause any symptoms. Instead, your body adapts to the increased acidity. For example, the kidneys produced more bicarbonate to help maintain your acid balance. Chronic respiratory acidosis may not cause symptoms. However, in chronic respiratory acidosis, the PaCO2 is elevated above the upper limit of the reference range, with a normal blood pH 7.35 to 7.45, or near normal pH secondary to renal compensation, and an elevated serum bicarbonate, HCO3- greater than 30 MEq per liter. Some people have chronic respiratory acidosis and develop a co-occurring illness that affects ventilation. This can make your chronic presentation worse, even if you'd never noted symptoms before. Doctors classify this type as a combined type of both acute and chronic respiratory acidosis. Initial signs of acute respiratory acidosis include breathlessness, headache, wheezing, anxiety, blurred vision, restlessness, a blue tint in the hands and feet if oxygen levels are also low. Without treatment or in people with severe presentations of respiratory acidosis, other symptoms may also occur. These include sleepiness or fatigue, lethargy, delirium or confusion, involuntary muscle movements and twitching, possible seizures, personality changes, and coma. The chronic form of respiratory acidosis doesn't typically cause any noticeable symptoms. When signs occur, they may include memory loss, coordination problems, increased circulation of red blood cells around the body, also known as polycythemia, high blood pressure in the arteries around the lungs, also known as pulmonary hypertension, heart failure, and sleepiness and headaches due to obstructive sleep apnea, OSA. The lungs and the kidneys are the major organs that help regulate your blood's pH. The lungs remove acid by exhaling CO2, and the kidneys excrete acids through the urine. The kidneys also regulate your blood's concentration of bicarbonate, a base which is on the other end of the spectrum from an acid. Respiratory acidosis usually occurs due to a lung disease or condition that affects typical breathing or impairs the lung's ability to remove CO2. Some common causes of the acute form are COPD, emphysema, asthma, pneumonia, conditions that affect the rate of breathing, muscle weakness that affects breathing or taking a deep breath, obstructed airways due to choking or other causes, overuse of drugs like opioids that affect the central nervous system, and some common causes of the chronic form are asthma, COPD, acute pulmonary edema, severe obesity that interferes with expansion of the lungs, neuromuscular disorders such as multiple sclerosis, Guillain-Barré syndrome, or muscular dystrophy, scoliosis, and amyotrophic lateral sclerosis, ALS. The goals of diagnostic tests for respiratory acidosis are to test for any pH imbalance, to determine the severity of the imbalance, to identify the condition causing the imbalance. Several tools can help doctors diagnose respiratory acidosis. The blood gas measurement is a series of tests used to measure oxygen and CO2 in the blood. A healthcare professional will take a sample of blood from your artery. High levels of CO2 can indicate acidosis. Electrolyte testing refers to a group of tests that measure levels of certain minerals and salts in your body, including sodium, potassium, chloride, and bicarbonate. One or more of the electrolytes will be higher or lower than usual in people with acid-based disorders like respiratory acidosis. Lung function tests can also be used since many people with this condition have reduced lung function. Several tests can help a doctor measure the effectiveness of your lungs when they're fulfilling the following functions: moving air into and away from your lungs, transferring oxygen into your bloodstream, or holding enough air. These tests include spirometry. A healthcare professional will have you breathe in and out of a specialized device called a spirometer. This measures how much air you move in and out of your lungs and how much air you move when you do it. The lung volume test. Seated in an airtight booth, you'll take deep breaths in and out. The amount of air your lungs breathe in will affect air pressure, which allows the healthcare professional to measure how much air your lungs can hold. The gas diffusion test. You'll breathe a safe amount of carbon monoxide through a mouthpiece that's attached to a machine. From this, your doctor will be able to measure how effective your lungs are at passing gases into the bloodstream. And finally, the exercise test. This involves running on a treadmill or using an exercise bike while monitors keep track of your blood pressure, blood oxygen, and heart rate. The exercise shows how your lungs function when you're physically exerting yourself. Chest X-ray. X-rays can help doctors see injuries, muscular issues, or skeletal problems that can cause acidosis. Other tests. Based on the outcomes of these tests, your doctor may also perform other examinations to help diagnose the condition that's causing the acidosis. Another condition, known as metabolic acidosis, may cause similar symptoms. The doctor may order tests to be sure that the problem is only down to respiratory problems. These tests measure the amount of acid in your body, which may be caused by kidney failure, diabetes, or other conditions, and include glucose, lactate, and ketones. Other tests include drug testing, a complete blood count, CBC, and urinalysis, a urine test. When you visit your healthcare provider with symptoms, they will begin a process to diagnose your condition. Since there are a lot of different conditions that often share similar symptoms, your provider will create a differential diagnosis, which is a list of possible conditions that could cause your symptoms. For respiratory acidosis, these include the following disorders and diseases: botulism, bronchitis, diaphragm disorders, diaphragmatic paralysis, asthma, opioid use, sedative, hypnotic, anxiolytic use disorder, chronic obstructive pulmonary disease, COPD, or obesity. There are several treatments for respiratory acidosis. Treating acute respiratory acidosis usually involves addressing the underlying cause. You should receive treatment as soon as possible, as acute respiratory is a medical emergency, as we mentioned before. For example, your doctor may need to provide interventions that clear your airway, such as bronchodilator medications. You might also require artificial ventilation through a machine like BiPAP, which assists your breathing and gas transfer without the need for invasive tubing. If you have chronic respiratory acidosis, your healthcare professional will focus on managing any underlying conditions to avoid an acute presentation of the condition. The goal is to improve airway function. Some medications for treating respiratory acidosis include the following: antibiotics to treat infections, diuretics to reduce excess fluid buildup in the heart and lungs, bronchodilators to expand the airways, corticosteroids to reduce inflammation, and mechanical ventilation to assist breathing in people with severe respiratory acidosis. The best way to prevent acidosis is to avoid the potential causes of the disease. Don't smoke. Choosing to live a smoke-free lifestyle may help. Smokers are at a higher risk for chronic respiratory acidosis. Smoking is bad for lung function, increases the risk of respiratory diseases, and can have an adverse impact on overall quality of life. Manage your weight. Some people with obesity can develop obesity hypoventilation syndrome, OHS, also known as Pickwickian syndrome, which can be an underlying cause of respiratory acidosis. Exercise caution when taking sedatives. They can interfere with your ability to breathe. Your nervous system plays a key role in breathing mechanisms, and sedatives depress the central nervous system. When you're taking sedatives, the following measures can help you protect your respiratory health. Always read and follow the label. Never take more than the prescribed dose. And avoid mixing sedatives with alcohol, as this can be fatal. It's not possible to prevent some causes of respiratory acidosis, such as having multiple sclerosis. However, the measures above may help you reduce your risk for an acute emergency. Thank you.